Good afternoon, one and all. Welcome to this webinar. Yesterday, in a session much like this one, some 1,100 Columbia affiliates, staff and faculty joined us, and today we're welcoming something like 1,300. These grand numbers signify a collective curiosity at an unsettled and uncertain moment, but also a moment with a good deal of optimism given vaccine development. We are at a moment, as it were, in between, and it's an especially good time to take stock together of where we are as a university in moving forward where possible to increase university density, but always with safety first. As we take stock together, of course, we're nearing the close of our fall term and pointing ahead to the spring, where we're currently engaged in significant planning. You will have seen that yesterday, President Bollinger sent a message to the community about the spring, which announced that we will be bringing back seniors in the college and Cs into residence. This was and is a measured and quite conservative act as compared to our peers. And it signifies how, as a university, we're have attempted and continue to attempt to move carefully, thoughtfully through this difficult time. As you all know, there have been considerable changes to the campus in terms of signage, tents, various forms of de-densification, 50% limits in our labs, and the like. But we've also managed across the fall to resume a good deal of university life safely. Library services, not in all our libraries, but in the core libraries have been revived. One could go through a list of activities that have been restored. Active teaching in a variety of modes, from in-person clinical training to all virtual undergraduate classes with a good deal of hybrid and high flex in between. I think we can say with collective pride that that no university elsewhere has done significantly better than we have, but there's no ground for complacency or self-congratulation. We continue with a mood and disposition of sober caution. Just a month and a half ago, we made some judgments about bringing to a halt some aspects of renewal. We've kept the gym closed for now. 5 libraries remain shut. What has mattered most to the campus is not these restrictions, but the common sense of community in which together we have obeyed the compact, masking, testing, attestation, hand washing, and so on, in a way that has protected us significantly. We've remained as safe a campus as any in the United States. And as we move ahead to plan for the spring, we will be we've begun to confront challenges we'll hear about today. How do we alter our testing protocol? How do we manage our facilities questions? What do we do about dining? What do we do about classroom limitations on space? How do we plan for the availability of a vaccine? How do we continue to ensure collective responsibility? We've also been surveying our students and have discovered just how keen they are to renew contact with the campus, with faculty, and with each other. And of course, we all have hopes for the longer future, pointing toward beyond to the summer and the fall in a post-vaccine world where we would hope to get as close to normal as possible. We're very fortunate to be hearing in a moment from 6 distinguished colleagues who have been leading the campus through the COVID phenomenon. Our moderator and first speaker will be Donna Lynne, who is Senior Vice President and Chief Operating Officer at CUIMC. And Donna serves as the university's COVID Director, overseeing policy implementation. Wafaa El-Sadr, next, University Professor of Epidemiology and Medicine and Director of ICAP at the Mailman School of Public Health. Melanie Bernitz, Associate Vice President and Medical Director for Columbia Health and Associate Professor of Medicine in the Center for Family and Community Medicine. David Greenberg, Executive Vice President for University Facilities and Operation. Jerry Rossberg, Senior Executive Vice President, and Joseph Greenwell, Vice President, Student Affairs in the Office of University Life. I know I'm very keenly looking forward to their presentations and our discussion, including the question and answers. And now I'd like to turn over the event to Donna Lynne, who will moderate the session. Thank you.
Well, good afternoon, everyone. And I want to just do a little bit of housekeeping around how the session will go. We will talk for roughly an hour, and then the remaining half hour will be question and answers. But you can log your questions into the Q&A function on the website. We'll attempt to answer them live during the session, but we'll also follow up during the Q&A period. This session will be recorded and posted on the website as well, so others that you know who couldn't listen can follow up later. So as you heard from Ira, and I just want to frame a little bit about what the fall looks like, and then what we're contemplating for the spring before I turn it over to Wafaa to talk about a broader public health perspective. As Ira said, things on the campus, despite every condition outside of us, are somewhat normal. Our enrollment is up. We see a substantial number of Columbia affiliates on the campus every day. One difference, obviously, is the mode of instruction, with the majority of our classes either being virtual or some form of hybrid. But we have students in residence in our university dormitories, and we've built in a lot of safety protocols that you're going to hear more and more about as we go forward. We've already in prior town halls and certainly on the website advised you of all the adaptations we've made to our facilities, our signage, and importantly also monitoring behaviors. The reinforcement of wearing face coverings, of keeping distance, and actually having a reporting system and disciplinary actions is really critical. I get hotline calls, I get other ways in which we find out whether or not there is compliance. And in addition, we've created a monitoring plan to make sure that as we look at environmental conditions, we modify our actions on the campus. You'll hear from Melanie to talk a little bit about our testing program. We've tested over 55,000 faculty, staff, and students since June. And we also do contact tracing. We're monitoring wastewater in 4 of our residence halls. And because there is a confluence of the flu season with what we're experiencing in COVID, we have a very rich free flu shot program that has been offered for the last several months and will continue to be offered going forward. Our positivity rate on campus is well below what is being experienced, certainly throughout the country, but even in New York City, it's consistently been below 1%, in the 0.22 range as of last week. We also take a look at what's happening in the hospitals that we're affiliated with. As you know, Columbia University is affiliated with New York Presbyterian. And this is a little bit of a graph showing you over the last 4 months where these hospitalization rates have been. There is definitely a slight uptick in the last 3 weeks, 2 to 3 weeks, and we are very concerned and watching that. In terms of other adaptations we've made for the fall, whether it's expansion of technology for our faculty, staff, and students, or supporting even our international students through work sites that make it easier for them to socialize, albeit with safety in mind with other students, but certainly have access to Columbia classes and technology. And finally, in terms of the supports that are in place this fall, we've done quite a bit to support our faculty and staff in terms of pay continuation and expansion of benefits. And we have enlisted a volunteer army of ambassadors who are reinforcing many of the safety measures that we think are essential to keeping our staff safe. And last, just what I want to touch on is some of the emerging issues. As you heard Ira say, we've been putting a lot of thought into what the rest of the year and certainly the winter term that begins in January will look like. That means watching COVID prevalence across the entire city, talking to other peer institutions. And certainly in the short term, we have Thanksgiving as a potential risk, which you've all heard about, and we'll be offering departure testing as well as return testing for those who do travel during Thanksgiving, consistent with what Governor Cuomo has asked us to do. We also know the weather, which has been good so far, is going to change, and we're working on more dining options, and you'll hear from David Greenberg, as well as making sure that our testing program is modified. The last thing that we continue to get quite a few questions about is vaccines. And we do have a group that is working on how the vaccines will trickle down from the government to New York City and ultimately to us. And more to come on that. There's a lot of unanswered questions, but we're very focused on that. So with that, I'm going to turn it over to Wafaa to give you a sense of some of the public health issues that are ahead of us.
And thank you very much, Donna, and I'll share screen. Great, okay, thank you. And thank you for being with us today. So let me get started. I'm going to focus on providing a public health update, and I'll focus on 3 areas in particular. Number one, a very brief snapshot on where we're at in terms of the pandemic, globally and locally. Then move on to talk briefly about some new findings in terms of some of the effectiveness of protective measures. And the third part will be focused on vaccines. So let me start first with where are we at in terms of the global, national, and local epidemic trends. As you can see here in this slide, what we have today is an ongoing transmission with now an estimated more than 54 million cases, confirmed cases of COVID-19, and the majority of cases are being reported from the Americas, from North and South America. And unfortunately, the US continues to lead in terms of the country reporting the largest numbers of COVID-19 cases. When we look at the United States in a bit more detail, as you're probably aware, we've reported already more than 11 million confirmed cases of COVID-19. And while the US is about 4% of the global population, we are reporting 20% of global cases. In addition, there have been now close to 250,000 reported deaths due to COVID-19, and this represents about 19% of global deaths due to COVID-19. If you look at the figure below here, it shows what we've been experiencing since the beginning of the pandemic in the US. We first had a sharp peak, which occurred in April in this country, and that focused primarily on northeastern states, including New York State. Then we plateaued at about 20,000 cases per day. Then we experienced another upswing, a surge in July, and that was largely in the Sunbelt states, and then plateaued at a higher level, about 50,000 cases per day. And now we're experiencing a third surge of this very large first wave and have reached record numbers of daily numbers of cases, up to 180,000 cases reported per day. And as you can see here in this map, that the majority of recent cases have occurred in the Midwest, particularly the upper Midwest. Now, what about the situation in New York City and recent trends? Overall, in New York, we've experienced more than 269,000 confirmed cases, currently about 961 cases per day, and almost 25,000, almost getting to 25,000 reported cases, death due to COVID-19. If we look here first on the right side of this slide, you will see the curve, epidemic curve in New York City. And this is the sharp increase in cases that we experienced in March and April, was followed by a slow decline in numbers of cases. Then we had several months in July and August and September as well, when we had very low numbers of new cases reported and very low numbers also of PCR or testing positivity. And then we started in beginning of October to experience this slow increase in numbers of daily cases. And if you look here on the left-hand side, you will see this increase that we've been experiencing here, particularly since the beginning of October. I want to caution you, though, if you compare, we're reporting now about 800 to 900 cases per day, which is certainly worrisome, but nonetheless, keep that in mind. In April, at the peak of the epidemic, we reported about 5,000 cases per day. When we look at trends in SARS-CoV-2 testing positivity, you'll see here again the 7-day average, and we're now at about 2.5% positivity rates for SARS-CoV-2 testing. And however, it's important to also keep in mind there's great diversity across different neighborhoods in New York City, with some neighborhoods reporting as high as 6% positivity and others reporting still less than 1% positivity. So the epidemic is quite diverse in our own community. Now, of course, following increase in cases, it's not surprising that we start seeing an increase in hospitalizations. You can see here in this figure, the increase in slow increase in hospitalizations since the beginning of October again. And we're keeping a very close eye on the capacity of New York City in terms of availability of beds, as well as the ICU bed availability as well. Now, this reminds us, of course, that because of these trends and worrisome trends and concerns, that we must, of course, heighten our vigilance and recommit to the various kinds of interventions that we've talked about all along, the population level interventions like the restrictions on travel and mobile and socializing with others, as well as individual interventions that includes the distancing, the mask wearing, the staying home if sick, SARS-CoV-2 testing, and so on. And these are what we have in hand now, which we call a non-pharmaceutical vaccine. Now, what about some new data? There's some interesting new data that, or at least might be of interest to you, as to where are infections happening. And these are cell phone mobility data, and what they show us, and these are data from 10 metropolitan areas, including from New York City here in the upper left-hand corner in this figure. And what they show us is that actually certain venues are where most infections are emanating from. And based on these data, in the blue here, this is the proportion of infections that are arising from full-service restaurants. In addition, here in the brown are from fitness centers like gyms. And you will see that these are responsible for a disproportionate number, again, of cases. So this includes restaurants, cafes, and snack bars, and so on, as well as fitness bars. So this tells us where most transmissions have been happening and where we should be particularly careful. There also are some new interesting data. We know that face coverings and masks are very good at preventing transmission from somebody who unknowingly has COVID-19 to others. And this is based on one study, but there are many others, of 2 hairstylists that had COVID-19. And they again saw about 139 clients for at least 15 minutes. And actually, since they were wearing face coverings themselves, and then clients were also wearing face coverings, none of the clients became infected. So this was one of the studies that supports the fact that masking and face covering is very important for preventing transmission from someone who is infected. We now have data that actually supports that, in addition, face coverings and masks are also very good at preventing acquisition, which means getting infected. This is based on some airborne transmission studies that have been done that show how the mask can protect the receiver in front of these aerosols and droplets, and also based on household studies that have been done, 2 studies that have been done. And both of these studies show that mask use by the index case and by family context, which is very important, that these wearing a mask was associated with substantial reduction by 79% and 70% in this other study of the risk of acquiring acquiring SARS-CoV-2 infection. So we have now data that show that face covering mask is also very good at protecting the individual who's wearing the face covering or mask. This is an interesting study also that was done in Kansas, where the governor issued a statewide mask order in July of about 105 counties in the state. Only 20 counties chose to enforce the mask mandate. And what's interesting is to see here in this figure down here is that in blue, you will see these are the trajectory of cases in the counties that adopted the mask wearing, and you can see the plateauing in terms of the numbers of new cases versus the counties where did not adopt the mask wearing. So let me shift now quickly to vaccines. Very exciting data on vaccines this week and last week. There are lots of vaccines in development, but what's most exciting is there are now 11 vaccine candidates that are in phase 3 studies, and these are the large studies that are done to determine that the vaccines work, efficacy, and that they're safe. So several studies are ongoing. I want to share with you results from 2 of the vaccine studies that were recently reported. These are early studies, preliminary interim studies. And the first one is of the Pfizer-BioNTech vaccine. This is what's called an mRNA vaccine. This is a new way of generating vaccines, which is very interesting and exciting scientifically. This is a 2-dose vaccine. One is given at baseline and then followed 3 weeks later by another dose. And there were, to date, a total of more than 43,000 participants have been enrolled and randomized to either get the vaccine or get placebo, with 42 participants from countries around other parts of the world and 30% of US participants from racial and ethnically diverse backgrounds. This is the only vaccine study that's ongoing that includes adolescents from the age of 12 onwards, which is important to keep in mind. And the preliminary data show that the vaccine was more than 90% effective in preventing symptomatic COVID-19, which means that actually it prevented, when you compare the vaccine group to the placebo group, there were 90% less cases in the vaccine arm of the study. There were also no serious safety concerns were observed, and the company is planning to submit to the FDA for an emergency use authorization. In addition, yesterday, there was also the release of data, preliminary data again, from another vaccine called the Moderna vaccine, made by Moderna. This is also an mRNA vaccine, so similar to the Pfizer-BioNTech vaccine. A total of 30,000 participants were enrolled in this study, 30% from racially diverse backgrounds, 23% 65 years of age or older, 17% with high-risk chronic disease. It's important to have this diversity in our vaccine studies. This is also a 2-dose vaccine study, baseline, and then at 28 days, the second dose is at 28 days. And again, the preliminary analysis showed that the vaccine was almost 95% effective in preventing symptomatic COVID-19. And you can see here there was a total of 95 symptomatic COVID-19 cases reported. Only 5 occurred in the vaccinated group versus 90 occurred in the placebo group. And there are also no significant safety concerns identified. And the company also plans to file for an EUA. So this is where we're at. These are the 2 vaccines I just talked to you about, the Pfizer and the Moderna ones. They're moving ahead to seeking an EUA, but there are several other vaccines that are also following behind. The Johnson & Johnson vaccine is distinguished that it's the only one that's 1 dose only. So that's also will be very exciting. Hopefully we'll see some results soon. Now, what of concern is vaccine acceptability in the US, and this is just one study that should provide caution to all of us. And the question was asked is, if a vaccine against coronavirus became available, do you plan to get vaccinated? And you can see here the results. Overall, only about 50% of individuals said yes, and about 20% said no, and the rest were unsure. And there's a distinction between by age, with older individuals more willing to get the vaccine. And also you look here by racial ethnic group, again, worrisome that amongst Black African Americans and Latinx populations, they were less likely to be willing to get the vaccine. And then you can see, of course, the politicization of the whole COVID response. We do have to appreciate their potential challenges, and that's why we need to start. And the university, we have already a vaccine group that is meeting to develop the plan for Columbia moving forward. And that will, by necessity, include, of course, providing information so that people would be eager and willing to take the vaccine. There are other challenges based on experience with the influenza seasonal vaccine, particularly because data have shown that over the past decade, the US has never really managed to vaccinate more than 50% of adults for seasonal influenza vaccine. And we know that in order to get the benefits from a COVID-19 vaccine, we really need to have at least 3 of 4 Americans be willing to receive the vaccine with a vaccine that has at least an 80% efficacy. So we need to get very high uptake of a candidate vaccine if we are to reap the values and the benefits of such a vaccine. In the US, there are several groups that have established prioritization plans for vaccination. This is one example from the National Academy of Sciences. And again, it shows a phased response. And as I mentioned, at Columbia, we are also discussing now similar phased response in terms of our vaccine planning. Globally, there's a lot of interest in providing access to vaccine globally as well. We do know that with pandemics and epidemics, they don't know borders, they don't respect borders. So we have to be also cognizant that we need to achieve high levels of vaccinations in the United States as well as other countries, because we are an interconnected world. And this is one initiative, the COVAX initiative, that's aiming to support low resource countries around the world to access these vaccines. But of course, vaccines will not be an immediate magic bullet. It's really important to reinforce that even if we had a vaccine available tomorrow, we will continue by necessity to need to adhere to the measures that I described before, the masking, the distancing, and so on and so forth for the foreseeable future, because it will take some time to achieve the high levels of coverage, both in the US and globally. So brief conclusions. The COVID vaccine pandemic continues to grow and evolve worldwide. The US, unfortunately, continues to lead the numbers of new cases, and we've reached record numbers of daily cases recently. New York City's experienced a surge in daily numbers of cases and rise in PCR positivity, which means that it's time for us to redouble our efforts, each and every one of us, to adhere to face covering, masking, distancing, and avoiding social gatherings. This is absolutely critical now so we can avert a further rise in numbers of cases. And COVID-19 vaccine development is moving at a rapid pace with very encouraging, astoundingly encouraging early findings. But of course, we have to face the challenge of making these vaccines available, as well as also enabling people to want to get the vaccine. And for now, very importantly, we need to continue to observe the protective measures that we know have worked well, and to reinforce amongst all of our colleagues, as well as family members and others, the importance of doing this at this point in time. I'll stop here, and thank you very much. And then I will hand it over to Melanie Bernitz.
Thank you, Wafaa, and good afternoon, everyone. Let me share my screen with you. Great. So I wanted to start by thanking you all for what you have done and continue to do to keep our community safe, and to remind you to be like Alma, and if you have not yet done so, please get your flu shot. Just a reminder of the important elements of our program that are keeping our campuses safe. Completing the daily attestation before coming onto campus, participating in the required testing and cooperating with contact tracing. In our testing centers, as Donna mentioned, on both campuses alone, we've completed over 55,000 SARS-CoV-2 PCR tests to date, and our overall positivity rate is far below New York City with a rate of 0.12% overall. We also have a very successful contact tracing program that I'll describe in a moment, with 100% of cases reached within the first 24 hours and over 98% of contacts reached within 72 hours. For many of us, completing the daily attestation before coming onto campus has become quite routine. And as such, if you've been selecting none of the above regularly, you may not have noticed the updates to the questions, which include some drop downs, making the system a lot more intuitive than it used to be now. So I do encourage you to click those boxes. You don't have to hit submit, but just to see the additional information that is included in the attestation. Very briefly, there are now 4 questions. For the question on COVID symptoms, if you do select it, you're asked about clearance by a healthcare provider. And if you have not been cleared, you'll get a red pass. But if you have been cleared, you'll get a green pass. The travel question has been separated out because of all the new information on travel, and allows those who've met the quarantine and testing requirements or who have an essential healthcare worker exemption to answer the drop down and get a green pass. There is a new question on close contact with someone with COVID-19, and if selected, the drop-down differentiates those who have been asked to quarantine and get a red pass, so those who are true close contacts, versus those who are proximate contacts who have not met the threshold for quarantine and will get a green pass. And finally, the question for those who've tested positive in the past 14 days allows the evaluation of the criteria to end isolation to be reviewed, giving you a green pass, versus the red pass if isolation has not yet been completed. Also, I ask you to please scroll down and look below the submit button. There are 3 check boxes for required elements to be on campus: signing the compact, completion of training, and gateway testing. And if one of these is not completed, it will need to be done to prevent you getting a red pass and inactivation of your ID and campus access. So our testing approach has been evaluated continuously, and adjustments have been made as the situation evolved. Gateway testing is now required for all members of the Columbia community, and this means getting an initial SARS-CoV-2 test before accessing campus. There were many faculty and staff who did not get one early on, and then were asked to do so as we didn't have any record of their ongoing access to campus. And we really thank those who have done this catch-up gateway testing in recent weeks, so you can remain in compliance with the university requirement. If you've received an email to do this catch-up test, or if you look at your app and the testing box under requirements is not yet checked, please schedule an initial gateway test through the Columbia testing program as soon as possible so you can retain campus access. We then have a few different aspects of surveillance testing. The most critical and important is actually our random sampling that occurs weekly. The size of the sample was increased and is currently at 10%, taken from those who accessed campus the prior week. And full participation in this is really essential for us to be able to accurately evaluate the prevalence of COVID-19 on our campuses. At the beginning of October, we added a pilot voluntary testing program for graduate students, faculty, and staff who were accessing campus 2 or more days per week and wanted to avail themselves of weekly testing. This program has been successful and is continuing through the semester. Even if you did not participate yet, but would like to, you're welcome to do so, so long as you are regularly accessing campus. We've also added a travel-related testing program, and this acknowledges the guidance from the state around departure testing before the holidays, as well as the testing requirement to end quarantine after return from travel, which I'll describe momentarily. And we can accommodate this testing at our testing sites as well. But my one ask is please to not come to our testing sites if you have symptoms of COVID-19. This puts the other people visiting the testing sites at risk, and this kind of testing should be done with a clinical evaluation. So for faculty and staff, if you are symptomatic, we ask that you reach out to your PCP or an urgent care center, and students should reach out to their campus student health service. So with regards to the testing program, please go to COVID-19 www.columbia.edu on the testing page and review all the different options and eligibility for testing. Access to this testing is available on both the Morningside and Columbia University Medical Center campuses, with convenient high throughput large scale testing center in Morningside at Lerner Hall and in the Black Building at CUIMC. We also do have testing available periodically at West 51st Street, Tarrytown, and at Lamont. An appointment is required and can be scheduled through the portal, where you can select your appointment date, time, and the appointment type. And the appointments are very quick and efficient. Most people report completing the process in less than 5 minutes. On the day of your appointment, again, complete your attestation. If you have symptoms, please cancel that appointment. And when you come to the appointment, we'll guide you through. The test is an observed, self-collected lower anterior nasal swab. It's quick, it's painless, and we're partnering with the Broad Institute for testing. Your results are usually available in about 36 hours, and the results come from CareEvolve to your Columbia email address. So be on the lookout for that. If you haven't received your results in 72 hours, please email us at covidtesttrace@columbia.edu so we can help you troubleshoot. And any positive results are immediately reported to you by one of our clinicians via the phone. So contact tracing, as you know, is a really important strategy to prevent spread of COVID-19. And in August, the university, through a partnership with Columbia Health and ICAP, established a comprehensive contact tracing program consistent with both state and CDC guidance to trace the contacts of any individual who's positive. Our goal is to assist in conducting contact tracing for all COVID-19 cases identified amongst Columbia affiliates. And we have contact tracing teams for all campuses. And we partner with the New York City Test and Trace program to ensure coordination of contact tracing efforts and to connect you to available city resources. The process is confidential. We don't reveal a case's identity unless they specifically request us to do so. There are many ways that individuals who test positive are connected to our contact tracing program. If you test positive through our testing program, you're automatically connected to the contact tracing program. If you attest to having a positive test via the app, or if a student tests at one of our campus health centers, you're also connected to contact tracing. And if you test positive outside of Columbia, we ask that you either let your supervisor know or that you email us at covidtesttrace@columbia.edu so that we can initiate contact tracing. Our goal is to call you within 24 hours of your positive result. We ask that if you do test positive, you can certainly let your supervisor know, but we ask that you don't try and conduct your own contact tracing. This has led to people telling multiple other folks in their work areas that they have been exposed without really understanding the infectious window or the close contact criteria, which can create a lot of unnecessary anxiety. And our team will be in touch and can do a full and thorough investigation. So just to reinforce, the CDC recently updated their definition of a close contact. So our contact tracing uses both the New York City Department of Health definition, which states a close contact is someone who's been within 6 feet of you for 10 minutes or more in a single instance, as well as the CDC definition, which is someone you've been within 6 feet of for a cumulative time of 15 minutes or more during a 24-hour period. And this cumulative addition has increased the number of people who fall into a close contact category if the 6 feet distancing is not maintained. Outside of clinical settings, use of a face covering does not impact the close contact definition. So we want you to understand what happens with contact tracing. As I mentioned, after notification of a positive case and always within 24 hours, including the weekend, the university contact tracing team will telephone the case and do a full and complete case intake. If you don't answer the call, we'll leave a message and send you an email, but we ask that you do respond as soon as possible so we can do this critical first step evaluation. You'll be asked a lot of questions to evaluate your infectious period, to see how you're feeling, and we'll provide you with resources you need while you're isolating and infectious. Then we'll ask you about your close contacts who meet that definition I just described during the period you were infectious, which is 2 days prior to the symptom onset or 2 days prior to your positive test if you have no symptoms. We'll ask you about members of the Columbia community who meet this definition, as well as any household contacts you live with that are Columbia affiliates. We'll also tell you that you'll hear from the New York City or New York State contact tracer to assess your contacts outside of Columbia, because our team is only responsible for Columbia-related contacts. Once this is completed, We'll notify the impacted school or department to let them know a case has been identified, how many contacts there are, and what, if any, facilities disinfection is needed. But we will respect your privacy and your confidentiality and not reveal your identity unless you agree to such a disclosure. The second step of the process is connected to all of those who meet criteria of close contact. We reach out to those individuals by phone, explain that they've been identified as a close contact and that they need to quarantine. We'll give them information and resources and let the school or department know when this is complete. And during both isolation of cases and quarantine of close contacts, our team reaches out frequently to check in. It's important to emphasize that if you have not been contacted by either our program or the local health authority, you're not considered to have been at increased risk and you do not need to quarantine. So really important to emphasize that. Oftentimes the contact's outside the infectious period. Our process has been really successful. We've been able to connect with all cases and contacts very rapidly, and by doing so, we've successfully quarantined individuals before they can become symptomatic and spread to other people. This has prevented potential for cluster outbreaks in many settings, and we've traced hundreds of contacts to date. And I will say the biggest lesson learned so far is where close contact is happening. It is not happening in classroom. It's happening during lunch and break times when people want the social contact, take their masks off and sit close together. It's happening during social conversations. So please keep this in mind when you take breaks and have lunch, and check where your desks or lab stations are set up to really ensure that 6-foot distancing is maintained. If you haven't done so, we encourage you to download the New York State COVID Alert app. Volunteers from the engineering and business schools were instrumental in piloting this app, and it provides up-to-date data about the status of the pandemic in New York, but can also alert you if you've been in close contact with an unknown person for more than 10 minutes, for example, in the grocery store or on public transit. And finally, some travel guidance. I wanted to remind you of the new travel quarantine requirement for New York State. Travel to the 5 contiguous states with New York does not require a quarantine. And if you leave New York for a non-contiguous state or other country for less than 24 hours, you do not need to quarantine upon your return, but you do need to get a COVID test on day 4. For anyone who leaves for more than 24 hours, there are 2 tests needed. The first, within 72 hours of your departure from the other destination. And then when you get to New York, you have to quarantine for 3 days and then get a COVID test on day 4. Once you receive negative results, you can then end your quarantine. If you do not complete all these testing requirements, you are required to quarantine for the full 14 days. And the only exception is essential workers who get a test within 24 hours of return. And as a reminder, travel-related testing can be scheduled at our surveillance testing sites. So thank you for all you've done to keep our community healthy, and I will turn over to David Greenberg. You're still muted, David.
Thank you, Melanie. I'll now share over my screen. Okay, so for today, I'm just going to give a brief update on where we are with our cleaning and HVAC protocols that have been in place throughout the fall, and touch base on some of the enhanced services that we've brought to the campus in terms of space and commuter shuttles and the intercampus shuttle. And then just touch on some of the planning efforts that we have for the spring semester. The cleaning protocols that we have put in place that originated in looking at how we are cleaning our facilities in accordance with CDC guidelines last spring are ongoing. Our high-touch areas will continue to receive additional attention, multiple cleanings per day, and in many cases we exceed the guidelines that the CDC has put in place as well. In the event of confirmed COVID-19 case on campus, the area that has been affected will be shut down. They are shut down, and we work on sanitizing that area before opening it back up. And that work will be completed within a 24-hour period of time. Any details that people want to know about are located on the COVID-19 website, including full adjustments in our cleaning routines from the fall. In addition to our cleaning protocols, we took a very close look and adjusted our mechanical systems protocols for the heating, ventilation, and air conditioning systems throughout campus. And all of our building air handling systems were tested and upgraded to make sure that they're operating as top efficiency and have improved filtration to the standards that the CDC put forward for the ratings of filters. In addition, we make sure that there's maximized airflow. Hours of operation have been increased to ensure that, and maximizing outside air being brought into our facilities as well. We have also started to check the ventilation in classrooms, research spaces, some public areas such as lounges. We've been working closely with SEAS faculty that have expertise in aerosols, and we calculate the air exchanges per hour within these rooms just to make sure that they're meeting the standards that have been put forward by ASHRAE, which is a industry organization, and CDC. In areas where we could not make mechanical adjustments, so we've improved the mechanical systems where the airflow was lower than we wanted. We have put supplemental HEPA air filters in accordance with CDC guidelines as well. It's very few locations. We've only needed to do 12 so far, and we continue this monitoring and assessment across campus. And these details on our HVAC systems and the campus building readiness is also posted on the website. Here's a couple places where you can find them. There are two different places to find information on building readiness. There's a COVID-19 website, and then also up at the medical center there is a very robust website on building-specific enhancements, and all of the protocols have been in place up there. For additional services that we have brought to the campus for the fall semester that will continue into the spring, we have installed 4 large tents on the campus. These tents provide space for certain functions, just community gathering, also opportunities for outdoor or covered dining on Hamilton Lawn, Ansel Plaza, Fairchild Plaza, and Dodge Plaza as well. And we are looking at placing an additional tent for the spring on the Fernald Lawn as well. These tents, the locations, capacities, and ability to reserve them for certain programming can be found on the web at eventmanagement.columbia.edu. And we also operate them in accordance with New York City regulations that at least 2 sides of the tent, 50% of the side coverings, will be open to allow for maximum airflow. In addition, as the weather has changed, we have installed and connected electric heaters, which will operate from 9 a.m. to 10 p.m. daily for use throughout the winter. As you can see here, these are pretty significant tents. We have them furnished with tables and chairs with proper social distancing, 6-foot separation. These photos were taken at times where you can see the community's made good use of them. This one in particular is the Hamilton Lawn tent. And moving on to another service that we've put in place or expanded to accommodate the faculty, staff, and students during this period of time is we have enhanced shuttle service for the intercampus shuttle. We now include a Saturday service and have extended the routes down to 96th Street to capture additional ridership on the west side of Manhattan. And the service at Fort Lee and Lamont shuttles continue as well. And we monitor capacities for just how crowded they're getting and look to adjust schedules and service accordingly. We've also put in place a commuter shuttle for employees in New York City. It serves the high-density areas of Bronx, Brooklyn, Manhattan, and Queens. As you can see here on the map, there are 4 lines, including one on the Upper East Side. And these seats for the shuttle, the commuter shuttles, can be reserved in advance up to 2 weeks. I'll show you how to do that in a second online. And these shuttles are operated just as the intercampus shuttles with requirements to wear face masks and with proper capacities and social distancing on board. To reserve your seats for the commuter shuttle, you can go to transportation.columbia.edu. It's a relatively easy 4-step process online. use credit cards. You can use your EPBA card in the payment information as well. Just touching on planning for spring, we learned many lessons over the fall. We had 950 undergraduates within the residence halls, and keep the retail dining locations open to serve the staff, faculty, and researchers that are on campus. And dining services not only prepares meals and delivers them to students in quarantine isolation, but we have been providing grab-and-go boxed meals for over 1,000 students, for the 1,000 students who have a meal plan. And we're looking at expanding the service for the additional students coming in the spring. And we'll be prepared to do that. And the residence halls will follow the same guidance that we put in place for the fall, which is students will have single occupancy bedrooms, and we will keep the bathroom ratios to at least a minimum of, maximum, I should say, of 4 to 1 when fully occupied. And we will also have reserved Fernald Hall as isolation quarters for the semester. On the graduate and professional student housing side in the residential apartment portfolio, continue the policies that we put in place for the fall, which is a reduced occupancy in shared units. So there are no shared bedrooms, much like in the undergraduate portfolio, no roommates, and also reduced ratio for bathroom use as well. We've increased flexibility in move-in times for apartments to limit the bottlenecks, extend hours, work with the supers in the various buildings for the convenience of students moving in, and worked very closely and continue to work closely with the graduate and professional schools on their allocations and giving priority to students who gave up their housing during the pandemic, when the onset of the pandemic, when they moved out, who wished to return into CU housing. And in addition to the isolation housing that we've set aside at Fernald, we've also set aside 70 apartments in this portfolio to add to the isolation and quarantine stock. We do anticipate challenges as occupancy increases on campus, and we're looking at the winter rolling in. I actually want to thank the essential staff very much for all the work that they've done in this fall and what they will be doing to accommodate our population. And the challenges that we're facing with an older campus, some narrow areas of hallways and stairwells, elevator banks, people be patient. There may be more wait times. If you're able to take the stairs, please do. But most importantly, follow the guidance that Dr. Bernitz and Dr. El-Sadr have been talking about in terms of following the compact, wearing a mask, and a little kindness will go a long way. And with that, I will turn it over to Jerry.
Thanks, David. I'm going to comment on just one point to save as much time as possible for Q&A. We spend a lot of time, including at this session, talking about life on campus. I want to speak to those on our administrative staff who have been working remotely. First of all, thank you. We understand this hasn't been easy. Your ability to work effectively remotely, often in very challenging conditions, has been a key part of our overall response to the pandemic. You've allowed us to keep operating at outstanding levels of performance while enabling us to keep density on campus as low as possible. Without this, we couldn't have made the progress we have. Many of you are understandably eager for guidance on when you may be required or permitted to return to work on site. I've seen the questions in the Q&A. When will we be back to normal with everyone, including me, back on site? This isn't just a matter of general interest. For those of you who have not yet been able to return to work on site, what should you expect as a return date? What notice will you get when that time comes? Let me start with the notice part, as it's the easiest to address. Our policy has been, and it remains, that you will get at least 3 weeks notice before being expected to return, except in limited circumstances where urgency makes that unfeasible. We know that changing your workplace will be disruptive for many of you. The hope is that 3 weeks will give you time to adapt. If you've been working remotely from outside of New York State and will be subject to quarantine requirements on your return, we would expect you to meet those requirements during the 3-week notice period. But let me now get to the hard part. When should you expect to receive this notice? I wish we could give you a target return date to help your planning. Unfortunately, we can't. For any particular person, the date will depend on your specific circumstances, on the requirements of your particular job. But more generally, there's still great uncertainty about the course of the pandemic, as you've heard today. Density of our buildings will remain an important consideration for the foreseeable future. That means that a general return is not imminent. For your planning purposes, those of you who are now working effectively remotely should expect to remain remote well into the next term, perhaps for all of the next term. I understand this answer isn't satisfying. I wish I could give you a crisp date and give you confidence that that's how it's going to play out. The truth is that any target date we might specify now would be little more than a guess, subject to adjustment as events unfold. So please know that we'll provide more guidance when we can. For the time being, expect to continue working remotely. Thanks. I think now over to you, Joseph.
Thank you, Jerry. Hi, everyone. I'm going to share my screen like all of my colleagues here. I'm going to give you some updates regarding the student experience and what's been going on and supporting our students. I'd like to give gratitude to the deans of students, student affairs professionals across the campuses and the central units, and to all of you, faculty and staff, who are supporting our students and supporting the compact. We have kept our students informed, so including every Friday, we send a message to all students reminding them to keep the compact and of student resources available to them. We launched the Student Voices campaigns, which are vlogs and blogs of students sharing their impact with COVID-19 and why it's so important that we all support each other in supporting the compact. And we have 595 students who have received specialized training. This is available to all students. If you have a group of students you'd like to have specialized training about how to step in, the importance of the compact and why it's here and what's going on with COVID-19, you can reach out to University Life and we'll connect you with our partners at Columbia Health who are leading those efforts. And I'd like to share this short video from Ochuko.
If I could tell other Columbia students about the need to work together to prevent the spread of COVID-19, I would tell them to take this seriously. The effects of the way we interact on campus doesn't just stay within the walls of campus. Like, the virus has a chain effect. So it goes beyond our walls. It goes beyond our friend groups. It goes beyond people we interact with. My name is Ochuko Okor. I am a graduate student at the Graduate School of Architecture, Planning and Preservation, and I am keeping our community healthy.
Thank you, Ochuko. And we have many student voices that are talking with each other and supporting each other in these difficult times, including our keeping our community healthy student ambassadors. We have over 424 trained student ambassadors who are trained how to step in both in person as well as virtually. And this is a quote from one of our ambassadors who had a great experience walking around campus and talking with students about the importance of the compact. We now have 3 student leads for the student ambassadors, Pilar, Kyla, and Shelly. Thank you for your leadership and dedication. And they are really organizing the groups to really be student-led and student-focused. They are now connected as well to COVID-19 Student Services Corps, which are CUIMC students who started this initiative, but it's now campus-wide, and they're doing incredible impact to COVID, and I thank them for their leadership. And we will continue to recruit and train ambassadors into the spring semester with a train the trainer model, because our model is to have as many student ambassadors as we possibly can in supporting each other during these difficult times. I wanted to remind you around student accountability that everyone can and should ask others to comply when they're not following the compact, and seek assistance where maybe it feels a little uncomfortable to you in order to do that. You can submit an incident report if they don't comply after you've spoken with them. You could do that at the top for students at the University Life website at the top right-hand corner. I remind you, please provide as much information as you can, including their name if possible, but date, time, location, and additional details. We are doing doing daily accountability reports, and we're looking at what are those trends. And so as of yesterday, we had 179 reports that included 618 individual students. And you will see these large kind of spikes. Those are singular incidents in many ways, like 76 were a line of students not physically distanced. 82, the most recent, is around potential travel restrictions and breaking those. And so we're going to look at all of those reports and then continue to work with our students. We also do a resolutions report once a month. And two things to note: the largest population here are students we couldn't move forward with because we didn't have enough information. So again, your reports are very important to provide as much detail as possible. And the second largest group are policy education. These are students that had low level particular complaints and reports. And so the majority of our students are not doing any kind of high risk behavior. And then we've had a few of those, and I'm happy to say we have not suspended any student. We have restricted access for periods of time, but our model is to change or correct behavior, to educate our students and support them in continuing to comply. We continue to create a vivid, vibrant virtual experience at University Life with over 18 University Life events virtually with 7,000 participants this fall alone. And this doesn't even include everything that's happening at the schools with student affairs and central units across the institution. Student well-being continues to be at the forefront of everything that we do. Big kudos in respect to Columbia Health and CUMC Student Health Services, who put everything virtually online, including virtually counseling, referrals to providers, support groups, 24/7 phone access, and they're there to help you. If you see a student that you're worried about, reach out to them and consult with them and partner with them in respect to those needs. And last but not least, the Global Centers Initiative. International students have been impacted greatly by COVID-19 and feeling separated from the institution. So the Global Centers has taken the lead with campus leadership across the institution in order to provide more spaces and more opportunities for international students to connect. We have 4 types of spaces now. We have the Global Centers. We now have Columbia dedicated WeWork spaces, 7 additional. We have 50 other cities that are providing all access passes to students. And we have partnerships in 2 other locations. So we have expanded our footprint across the globe, providing study and community space, capacity for student gatherings, virtual instruction, specialized programming in person and virtually, as well as specific international communications. And that's been a momentous campus-wide effort, campuses-wide effort from all of our campuses. And those are some of the highlights. And again, thank you for all of your support.
Well, great. We're going to turn to questions, and we have a number of those of you who are not watching the Q&A section. We have already answered 76 questions by typing busily while the speakers were talking, and we've got a number of additional questions, and there are quite a few around, I would call them the public health questions. And one important one that I want to ask Wafaa to answer is we did get a question or a statement from one of the participants that it appears as though Columbia is in what's called the red zone. And what are we going to do about that? And Wafaa, I'd like you to amend that statement and tell us where you think we are and what we need to do as we go forward.
Yeah, well, I can definitively say that Columbia is not in the red zone. I think what we are is at this point in time, really focusing on reinforcing a lot of the measures that I mentioned and many others mentioned because of the noted surge in numbers of cases and positivity in our city. I think that's the focus of our work now. We are maintaining density as is, no more than 50% density on our campus facilities, but reinforcing again the importance of distancing, the importance of face coverings and masking, and of course adherence to the testing regime that Melanie mentioned.
Great, thank you. There are, Wafaa, also a few questions about the vaccine. I'd like to continue with you if that's okay. One of them is when will Columbia anticipate providing, or will Columbia anticipate providing faculty and staff with the vaccine?
think it's a tough question. As I mentioned, again, these companies are going after an emergency use authorizations from the FDA, which would allow the distribution essentially of vaccine doses. There are national plans, as you saw, the ones I shared with you, as well as also New York State, and potentially also New York City will have a plan as well for deployment of the vaccine. At present, Columbia has put together a group that is focusing on answering some of the questions that many of you raised on this webinar, including who is going to get priority, how we're going to sequence the priority groups, is it going to be mandated or not, et cetera, et cetera. So a lot of your questions will be answered over the next few weeks as we work through some of these issues in the vaccine group.
So another related question, though, Wafaa, that I think precedes the deliberations in the vaccine group is a question about are the vaccines that are coming out now the real deal? Are they final, or will there be subsequent vaccines that are in fact perhaps more effective or easier to administer?
It's hard to imagine more effective than 90 to 95%. So I think this is remarkable. I think the FDA had put a threshold of 50% effective in order to consider moving a vaccine forward. So 95% is remarkable. I think the complexity with these two mRNA vaccines is that they require 2 doses. Clearly, it would be easier and much more easier to deliver, but also to ensure uptake if we had a 1-dose vaccine. We don't have such data on such a vaccine as of yet. The other issue with these 2 vaccines is that they require keeping at low temperatures, particularly the Pfizer vaccine, and to a lesser degree, the Moderna vaccine. So this also adds another complexity in terms of distribution of the vaccine, particularly in other countries where maintaining cold chain would be difficult. So I think the data from these 2 mRNA vaccines are very encouraging, but I look forward to data from the other vaccines because they're using very different vaccine candidates. And we really want to have a possibility of having a menu of vaccines available for people based on their needs and also their preferences.
Great, thank you. Joseph, there's a question for you, which is there a listing available of the student ambassadors?
Sure. We don't have a published list, but we do have a list, and we do have them by schools. We've shared that with the deans of students with each of the schools. And then if people have particular interests, they can email me directly, and I'd be happy to connect with you, what your needs are, and connect you with the 3 student leads.
Great, thank you. We have some questions about testing. I'll turn to Melanie. One is, could it be possible to add a testing site in Manhattanville, even if it only operates on a limited basis?
So right now we're not adding that testing site because the learner testing site is huge, has tons of availability, and is very quick. So we do ask that you come and utilize the learner testing site. The hours of operation hopefully allow you to do this without adding time to your day.
Great, thank you. We have another testing question, which I'll stay with you for a little while. If 1 or more people test positive for COVID-19 in a lab, what happens next? Can the lab remain open to other lab members that were not near the positive lab members?
Absolutely. So what happens when we get 1 or more members in a lab test positive, we launch the extensive contact tracing investigation that I described. What the labs have been doing a terrific job with is having people work in pods or in shifts. So oftentimes, even if some other lab members have to quarantine, once we do close the lab for 24 hours and do the disinfection, it's possible that other lab members who've been working different shifts are able to continue the work and keep the cell lines alive and do whatever they need to do. So we just ask that you give us 24 hours to do the contact tracing investigation, and then we'll provide guidance on who can safely return and who needs to stay away.
Melanie, connected with that, and I think you gave a great explanation on contact tracing, but we have a question that the individual understands the need for confidentiality of individuals who might test positive, but would it be possible for individuals who are in a building or in a program to be told and when someone tests positive, and then those individuals could make their own decisions about whether or not they want to come into the building?
Sure. So when we do identify a case, we do let the department know. And even if we are not revealing the identity, we do provide a notification template so that a notification does go out to the department or the lab or the class that was impacted by that to say an individual has tested positive. We also provide a lot of reassurance with that. We let you know that facilities cleanings have happened. We let you know that contact tracing has been completed and those who are identified as close contacts have been notified. And we hope that that provides reassurance that the space is safe for others to now enter and use. We know that you may have had passing contact but doesn't reach the threshold for being close contact, so it doesn't need you to stay away. So we do provide those notifications, and we've gotten better and better at this. Departments are getting really good about sharing these notifications, even if it's outside of their department, but it's shared space. So you should get the notification so you know if it has been in your area. Great,
thank you. I'm going to let you take a break for a minute and turn to David Greenberg. We have a question. Will students who are given on-campus housing in the spring be able to quarantine on campus if they're coming from out of state, or will they have to quarantine beforehand?
We're currently evaluating what our capacity to do that is right now. There will be the ability for some students to quarantine in place, but we're awaiting further guidance in conjunction with the state on that front.
Great, thank you. Wafaa, are there any other mRNA vaccines for other illness or viruses?
Apologies. No, this is a new technology, this mRNA technology, and has not been used previously. So I think it's really good that we have two different vaccines created by very different laboratories and so on that are being evaluated. But this is the first experience with mRNA vaccines. But these vaccines do not use live virus. So I think just to assuage anybody's anxiety of any potential infection from these vaccines, they do not use live viruses or even attenuated viruses. They use genetic material from the virus to stimulate our immune system to generate antibodies that can then fight the virus if we get infected.
Thank you. And just to amplify your answer about red, we have another question because there's been a lot of publicity about the New York City public schools shutting down when the entire city gets to a 3% positivity rate. Could you talk about what Columbia is using as its thresholds for either shutting down or changing the way we're delivering our classes and our work?
Yes, just to, in terms of the 3% positivity that the mayor has selected, it is an arbitrary number. We all know that, and I think it probably was negotiated based on a lot of stakeholders involved in schools and so on. In terms of our own monitoring plan, we use a suite of different kinds of indicators, and we do not use one specific, like, for example, what the mayor has suggested or has been using for what he's saying to close the schools. So we have a suite of different metrics, both for the city as well as also metrics for what's going on campus.
Okay, I'll take a couple and give everybody a little bit of a breather. We obviously live and work and go to school in surrounding communities of Washington Heights, Harlem, and the Upper West Side. One question was, have we thought about the impact on what we're doing with our communities? And we've had a continuous dialogue with community leaders on our plans and continue to do so as we change either the number of students that will be residing on campus or going to classes in something other than a virtual format. There is a concern that one of the participants expressed about the positivity rate in Washington Heights, which is increasing above certainly above the 3%. And we are watching that very carefully. And as I said, one of the indicators that I look at is the number of hospitalizations on the 168th Street campus. And that's definitely something that we're very concerned about and working on how we mitigate that. I have a question for Wafaa on contacts. The question is, if a person has contact less than 6 feet for 15 minutes with a known COVID positive person, but both wear masks, is that considered a contact requiring quarantine?
Yes, the definition of close contact is irrespective of masking. And that's why it's really important to be more than 6 feet distancing, irrespective. So even if you're closer to 6 feet and wearing a mask, you're considered a close contact. I hope that's clearer that way.
Great. We have a question about the drop off for the shuttle in Brooklyn. I think it's John. I think it's J Street, but I'll turn it over to David to answer that question. There is a map on the website.
Yeah, there's a map, and also on the Passio Go app, you can find the location for the individual shuttle stops. If that's the question as to the actual location, then it can be found on the Passio Go app as well.
Great. Jerry, there's a couple of HR questions that I'm going to throw to you. One is from an individual who says this person doesn't want to come back on campus since they can do their work remotely, but their supervisor wants them to share public-facing duties, to share the burden of what others on the team have to share. Can you talk about what that person's options might be?
Well, I certainly don't want to try and answer a specific question without knowing all the facts. I think the most important point is to take up the question with the HR unit where you work, or to go to central HR and take it up with them. There are some tricky choices to be made here. And it isn't actually up to each individual to decide, each administrative person, whether I'm needed on campus or not. That's something that is got to be worked out with the people with whom you work. So my advice in that situation would be just to take it up with HR. And if you don't like the answer that you get from your own local people, go to central HR and take it up with them.
Great, I've got another one for you, which is that since we are potentially going to be doing more classes in something other than virtual and having more students on campus, i.e. seniors, that means the number of people on campus will increase. So does that mean that we will be reducing the number of people working on campus in order to meet the 50% density requirements?
Well, I think the short answer to this is that we never thought this was a one-way street, that we would increase density, but that we would never decrease density again. And that's not right. The assumption was that we would learn from what happened in the course of the pandemic and adjust as appropriate. So it is conceivable that we could face situations where we wanted to reduce density and ask some people who are on campus to go back home. But that's something we're going to be guided on by the public health people. And I don't think we're in that situation yet, but it could happen.
One of the questions that I think we tried to answer by typing was about giving access to family members to testing. And I think there's a clear answer. We are not doing that right now. As I mentioned, we've done over 55,000 tests already, and that will be increasing as we go into the winter term. So at this point, we are not contemplating giving access to family members. Family members can use New York City resources and also other private entities like CityMD and so forth. Wafaa, could you clarify what face masks are recommended from a public health perspective? There's surgical masks, there's cloth masks like the ones we've given out, and of course there's N95s.
Sure, and by the way, there was another question, Donna, that people really like the Columbia masks and wondering where they can get more of them. So
I
that's
saw that.
that's a very good sign, and I like them myself. I find that they're two layered, which is exactly what you want, and they at least fit me very well. So I think what we need from face covering is any two layers, ideally, and also that are shaped to the face and are so that you can have a good fit and achieve good filtration. So that can be done with a face covering. Surgical masks are also available and can be utilized as well. N95 masks are not recommended for the population overall. They're recommended for healthcare workers engaged in specific procedures, and they also require a specific fitting processes also for their use.
Great. And the answer to the question about could you get more Columbia masks right now is no. We've had tremendous demand for them both in our testing centers and in other settings. But we'll take that up for for the winter term. I'm gonna turn to Ira, if I could, and ask him, sorry about that, about whether or not we are in the process of thinking about any changes in benefits, Ira or Jerry actually, whether it's flexible spending accounts, child care, other things that might deal with the issues that people who are working, particularly working at home with children, have to face. Jerry or Ira, which one of you?
Jerry, why don't you jump in?
Sure. So we think about this all the time. We understand how stressful these conditions are. Childcare at the top of everybody's list. There, as I think all of you know, there aren't perfect answers to this. Some of the things that could be done are extremely expensive, but many of them are problems that even money just can't solve, that people are wrestling with. So we monitor this situation constantly. We've paid a lot of attention to what's gone on in the last couple of days with the New York City schools in the hope of being able to adjust. But we do watch it constantly. The questioner also referred to the spending accounts. And what you should know about those is that those are all, because they're tax advantaged, they're heavily regulated. And a lot of the things that you might wish that we could do, we're just not permitted to do. So it's, I wish I could give an easier answer to this, but it's certainly something we look at all the time.
Thank you. We have a question which I think I can take, which is what face coverings are required for the outpatient clinics. The Columbia face covering is not an acceptable face covering in the outpatient clinics. You must be wearing surgical masks, and if you are, and you certainly can't be wearing bandanas or any other form of face covering. Your department or the faculty practice organization have sufficient surgical masks to give out. And as you know, when you have a surgical procedure, an aerosolizing procedure, you need to wear an N95 and in some cases a face shield as well as an N95. Ira, this one I think you can handle, which is there are a couple of questions about our visitor policy. And when are we thinking that we might allow guests on campus, whether it's alumni gathering for a class reunion dinner or others coming in who simply want to access the campus?
I think the answer is quite straightforward. It is truly as conditions as guided by our public health community allow. The present moment is not the moment to significantly relax a visitor policy, but as with the child care issue, it's something we look at week to week. And the central goal, of course, remains to safely increase density as time permits, but I underscore the word safely. And until we're confident that each step we would take to increase density can be done safely, we're going to err on the side of prudence.
We have a question about an individual who was sick with COVID symptoms and whether or not that individual should be taking sick leave or they should be taking administrative leave. And I'm happy to be corrected by Jerry, but I believe if you're sick with COVID symptoms, you take sick leave. If you're quarantining because you might have been exposed, you can take administrative leave. Jerry, is that a fair statement?
It's exactly right. There's a nuance there that's important. And that is that it may depend on why you had to quarantine. If you engaged in out-of-state travel that wasn't authorized and came back and are now subject to a quarantine requirement, that's a different case. But in the ordinary circumstance, if you're told not to come to work because you're on quarantine, you get that time off as an excused absence. That's not something you use either your sick days or your vacation days for.
Melanie, have been a couple of questions, and I think it doesn't hurt since the travel policy that the governor expressed has changed. Could you just restate, particularly given that Thanksgiving is coming up, what the pre-testing and post-testing policy is?
Sure. So it does not apply if you're visiting one of the 5 contiguous states around New York. So excuse my lack of geography knowledge, but I believe it's New Jersey, Connecticut, Vermont, Massachusetts, and Pennsylvania.
You were good except for Vermont, I think, right?
Yeah, Vermont is
Oh,
one.
because upstate,
Yeah.
right?
Okay, good. I win. So if you're visiting one of those states, it doesn't apply. If you're visiting somewhere just for 24 hours or less, you don't have to do anything other than get a test 4 days after you return to New York, no quarantine. But if you're going anywhere outside of the contiguous states, and this includes international to CDC level 2 and 3 countries, you're required to, first of all, get a test within 72 hours before you leave that other destination. Then when you come back to New York, quarantine for 3 days. And then on day 4, or whenever after that, if day 4 falls on a weekend and you can't get a test, whenever after that, get another test. You quarantine until you get another negative result. So you have to be in possession of 2 negative results, and then you can end your quarantine. So your quarantine could be 4 to 7 days instead of the 14 days. If you're unable to get that test within the 3 days before you leave your destination, you will be required to quarantine for the full 14 days. You cannot then test out of quarantine.
Great, thank you. We have a question, David, for you. Will the cleaning protocols be modified at all as we're going into the spring term?
We're keeping the same protocols that we put in place for the fall, which is the enhanced cleaning protocols. I think that that question was also put in light of a focus on HVAC, which we absolutely have as well.
Great, thank you. I have a question. Will the hiring, and Ira, I think I'm going to toss this one to you. Will the hiring of adjunct faculty who would only teach virtually from their homes abroad be permitted for the spring term?
This is actually a complicated question that involves tax law and legal issues. It is difficult to have persons abroad teach virtually and be paid in the regular way. We have accommodated students in that circumstance and some faculty in that circumstance through special arrangements. And we have to adjudicate this on a case-by-case basis.
Great, thank you. We have a question about more frequent testing. Melanie, if you could answer that. I know you covered our current testing. This is an individual who is interested in more frequent testing during the week, especially since they're on campus 5 days a week.
So currently we are capping the frequency at once a week. We continuously evaluate this. And as we have said all along, if the conditions indicated a need to change that, we would do so. But right now, weekly is the maximum.
Great, thank you. I'm going to wrap and ask Ira if he'd like to close with some concluding remarks. Just a reminder, this will be on our website. We did get a question about captions, and I'll follow up with the website team. But thank you all, and I'll turn it back to Ira.
Thank you so much, everybody, and thanks to all for participating. I just want to end with a statement about process. We have had, since April, 4 working groups at the university level on public health, on facilities, on education, and research. The research ramp up was in critical ways superintended by that working group. The facilities working group created policies which are actively being carried out that David reported about. The education working group continues to meet, and the public health group meets more than ever. We have an implementation group that Donna chairs that meets weekly to oversee the carrying out of our policies. We've had a COVID-19 task force at work ever since early February, end of January, early February, that meets frequently, meets again tomorrow, that oversees and shapes judgments about step by step. The deans meet in a council of deans each week, and each of our schools, including CUIMC, have created their own deep planning processes. So there's no shortage of places of careful adjudication, but the most important steps to be taken for campus safety lie with each of us as we follow the compact and as we carry out our activities as safely as possible. Please be assured that the university is doing everything we possibly can to create a safe environment, and as we feel capable of restoring density, to do so carefully, meticulously, and thoughtfully. And with that, I thank you all. I thank my dear colleagues for their extraordinary work, and I thank all of us across the campus who are keeping Columbia safe and vibrant. Thank you so much. Great to see you all. Take care.